Hi, I'm Carolyn, and I wanted to do a testimonial to the classes to give any parents out there validation if they're having doubts on to whether they should or should not take some classes.
I'm Blake, and in the first take, she said it was because I didn't have a choice. I had to go. No, it was so great to actually take a class rather than a book, and to have just that support and more comfort and knowledge around giving birth. I know I would want that if I was giving birth.
The fact that you definitely feel community in the classroom setting. It's not just you and your husband. There's lots of other parents out there, and so you really feel that connectiveness in a classroom.
Yeah, fun. And the potluck at the end. So good.
I am a registered nurse in the neurosurgical trauma intensive care unit at Scripps Memorial, and the type of patients that we deal with on a day-to-day basis are patients who have had strokes, major brain injuries, lots of traumas that kind of render their minds and their bodies totally built. So I deal with a lot of death and a lot of really sad and traumatic situations, but when it comes to birth, which is a totally different spectrum, I'm dealing with death on a daily basis, whereas this is bringing life into the world. I just felt like hypnobirthing was something that I always wanted to do when I was going to give birth, and the classes were definitely something that I felt was going to really educate me on what hypnobirthing was all about. Before starting classes, I had a little idea of what hypnobirthing was, but now that I've taken the classes, I fully understand what hypnobirthing entails and how to relax the body to get you into that state of mind that you need to be in right before birth. I feel like the hypnobirthing skills really allow the mom to turn off her brain and to just allow her body to do what it was built to do. And just coming from a work field that's so constantly going, constantly thinking about the next thing that could happen, this was a total 180 and just allowing my mind to turn off and for my body to take over. And I think the skills that I got from, not just from reading the book, but definitely from care, has allowed me to achieve this, and I have no doubt that I'm going to be able to do it during the birth.
I'm a therapist, psychotherapist, and I think the classes really helped me to just get a better sense, and I got just a healthier and more skillful perspective of what my wife's going to be going through. And I guess as a therapist, I think I'm often a big believer in healthy, adaptive, effective communication. And it was fun in the class to be like, that's not going to happen in the birth. And it's like, oh yeah, shit, that's right, that's not going to happen. So that was a good reminder. Like, yeah, she can be as bossy as she wants.
Learning the kind of touches that I want during birth.
Yeah, the touches are not touches, so
yeah.
Yeah, and it was a fun environment to do all that in. I think it was just a good reminder, just checking in with her and seeing what she might need from me and how I can be there for her, and then seeing the other partners there in the class and some of their doubts and stuff, those were also
helps you feel normal.
Yeah, it helps validate that, normalize it.
I do believe that reading the book is important, but I think being able to apply what you're reading in that book in the classroom setting, actually putting it into practice, is so important, because you can't just read a book or read a blog online or watch a YouTube video and then think, okay, I got this. You need to actually practice, and it seems silly to practice birth, but I'm so glad that Blake and I had that chance to practice, because now he knows exactly how to touch me, where to touch me. I know the position that I want my body in, or how I don't want my body in, or how I don't want him to touch me. And I just can't imagine giving birth without having that classroom opportunity. Besides being in the classroom, things that care has taught me is just, and if you ever take CARE's class, you'll know the 40 blinks that I got helped me kind of transport me into a whole different realm where you completely take half of your senses are gone right away, and it's just you're in this new place where you can truly focus on what your body was meant to do. And so I'm grateful for Care and introducing me to the 40 blinks and also the birth ball. And those are things that a lot of people already know, but I think a lot of doctors and nurses out there might not understand the benefits to using things like the birth ball and the 40 blinks and to practicing with your partner before birth. So I'm very grateful that I was able to take a hypnobirthing class before I actually give birth. I have lots of doulas in my life, one of them being a very close friend of mine. So before ever getting pregnant, I already knew of doulas and what they do and why they're so important. And I think that put me at an advantage than a lot of other moms, because they come into class and they're hearing the word doula for the very first time and they don't quite get that concept or understand what a doula does and who they are. And I've even heard of people saying that doulas are more of a bougie thing that only rich people can do. And I just don't agree with that at all, because I've never given birth. My husband's never been at a birth. We don't know what we're doing, but now we have this person in our life who's become almost like a third member to this party that we have going on. And she's gonna be by our side the entire time. The moment I start feeling those contractions and know that it is true labor, she's coming over to our house and she's staying with us the whole time. She's making sure that I'm as comfortable as I can be, that I'm in the positions that will help me. But not just focusing on me, she's also supporting my husband, which I think is very, very important, because I can't be there for my husband anymore. I have gone into my own journey and I'm on my own. I can't cater to him and I can't listen to anything else that's going on in the world. So I have this doula who knows what she needs to do. She knows how to take care of Blake. She knows how to take care of me. She knows when it's time to go to the hospital. And because we've already met several times before I actually go into labor, she knows my birth plan and she knows what I want and what I don't want. And she can relay that to the doctors and the nurses. And I think that's really important, because that frees Blake up to be by my side, be my supportive person. And then therefore she's Blake's supportive person, because now she's coaching for both of us. And I think it's important to just have that third person to really make sure that you have the birth that you want to have.
About having a doula, awesome and really good. She's way less likely to yell at me with a doula there. So no, I think it's awesome to have that support. We really like her and she's super fun. And yeah, and I think I remember when I first heard of doulas, I thought that was something like kind of bougie or rich or something, and it's not at all. It's very affordable. I think it's like having a support, like a real support system there for that day. It would almost feel silly not to have that, an advocate or someone that you know is going to be there and is familiar with that birth plan and all that stuff. So
I think it's just important to have that advocate that is seeing your situation from the outside, because Blake is going to get overwhelmed, I'm going to get overwhelmed. We will no longer be in our right minds, but our doula will be. And I think just having that advocate is so important. Because I have a close friend who's a doula, I already knew a lot of how I wanted my pregnancy and birth to go. So when I found out that I was pregnant, I knew right away that I wanted to take classes with Care, that there was no doubt in my mind about that. And I think it was maybe 6 weeks when I called Care, and that's super early, but I went on her website and I just kept reading, sign up as soon as possible. So I called her and I got in right away, which was great because I was, I think, 8 months ahead of the game there. What I really liked about Care is she asked me right off the bat, do you have a doula? Are you gonna get one? And I already knew what a doula was, so I didn't have to talk to her about that, but I think that's a great conversation starter. So if you don't know what a doula is, you've never heard of one, it's a great time to ask her what is that exactly. And what I really appreciated was that there are different tiers, different price ranges for doulas. So if you feel like you can only spend a certain amount of money on a doula, she can help you find doulas that are in your budget, because they do range from not that much to more, and I'm sure a lot of people think that it's not worth it, but it's so worth it. And if you just think about a nice pair of shoes or a nice dinner or a weekend getaway, how much you spend on that, and think of a doula as a truly an investment to you and your baby, it's so worth the money. If you have any doubts, I definitely recommend to take classes. It doesn't have to be hypnobirthing, but I truly think that some sort of in-classroom setting class is very important. Like I said earlier, you've got to practice, and you can't just read something and think, okay, I got it. You really need to practice with each other what you're learning in classroom, and I think being in that group setting is very important.
And Kara makes it fun too.
She does make it a lot of fun.
So.
And another thing I was gonna say is, if you're worried about time commitment, the hypnobirthing that we did was 5 weeks. I'm sure there's classes out there that are longer or shorter. It was once a week for 5 weeks, about 3 hours long or so. And we changed our work schedules just so that we could make this happen, because it was so important to us. And so if you think, I work that day, I can't go, see what you can do about changing your work schedule in order to go, because that's how important that this is. It's a true investment, and it's not just a class. This is a preparation to you bringing your baby into the world. And so it goes way beyond the classroom, way beyond any blog or website, and you need to treat it as such. You're not going out and buying a car. You're literally giving birth to life and bringing it back into your home.